Hello everyone, my name is Dr. Benjamin Kamel and I'm going to be talking to you guys today about bunions. So bunions are not just a bump on the inside of the foot. Rather, if you can take a look at the clinical images with their perspective radiographs, you can see that a bunion is a separation of the first metatarsal, which are the long bones in the middle of the foot there, separating from the second metatarsal. And the wider that angle, the more severe the bunion is. This can often lead to a bump on the inside of the foot. However, that is not, is not excessive bone growth around the inside of the foot. Just for setting a definition here, and this is important as surgical treatments sort of revolve around this concept of how severe the bunion is. So, as I've alluded, it's not really so much an extra bone growth, but they can develop a bump on the side of the inside of the foot, and this is due to the big toe sort of, the first metatarsal going outwards or towards the inside of the foot, which leads to the big toe leaning in towards the second toe. Very classic appearance, and this is a progressive deformity. It gets worse with time. Despite what most people believe, bunions themselves are not hereditary. However, the faulty mechanical structure of the foot, or what leads to weakening of the capsular or ligamental structures on the inside of the foot that lead to a bunion, oftentimes the reason why your mom or dad developed a bunion is the same reason why you have inherited those reasons that have led to a bunion. Shoe gear, specifically high heels or any kind of tight fitting toe box shoes can lead to a bunion. And also some patients have collagen disorders, which can have weakening or lax collagen or ligaments, which can lead to a bunion. What are the symptoms of a bunion? If the big toe deforms enough, this can cause stiffness at the joint and can lead to movement. However, most times the pain is due to irritation. When you wear a shoe, there's irritation along that bump, which can become red, and that friction can swell and cause pain. There is a nerve that runs over that specific part of the bump, which can also be irritated and lead to sort of a tingling or numbness or burning sensation within the toe. Treatment options, like with most things in the foot and ankle, can really be, treatment can really start with a good supportive base, and that's, a good supportive custom foot orthotic. The reason for an orthotic is that you can decrease the amount of force going through the inside of your foot. Basically, the mechanism or the structure of your foot that caused the bunion, we can slow down that progression with an orthotic. And a good supportive shoe. Oftentimes or sometimes patients may need injections around the bunion. However, this is less often than things like toe arthritis or ankle arthritis. And physical therapy can also be beneficial. When it comes to surgical treatment, there is a time where non-surgical treatment stops working. No matter what you do, oral medications, change in shoe gear, wider toe box shoes, physical therapy, injections, icing, resting, anything, all of these things can eventually stop working. And it may be time for surgery at that point. And there are so many surgical treatments for a bunion. I mean, there can be, over 100 that have been done before, or at least documented in the literature. However, there are sort of a handful that I do and that most surgeons use now because they have been a little bit more reliable and have led to good results. But which procedure is best for you all depends. So we're going to revisit this model here because depending on the severity of your bunion, this will dictate which procedure is best for you. So we'll start with the mild to moderate bunion. So with the mild to moderate bunion, we're looking at a deformity that doesn't have so much of a wide, what we call intermetatarsal angle, or the angle between the first and second metatarsal. So we can make a cut in the bone and shift it over, put some screws in it to help hold the position and decrease that sort of deformity or the bump on the inside of the foot. This can be done in a couple different ways. The traditional way, which is making a sort of a bigger incision over the joint, opening it up, visualizing the bone, making a cut in it, shifting it over, and putting a screw. There may be another cut that may need to be done in the toe itself and not just at the metatarsal, and that's case by case. There's also a minimally invasive option, and this is basically doing the same thing, which is a cut in the bone, shifting it over, and putting screws in it. And this can be done with small incisions, and we use small, burr instrumentation to make cuts in the bone and to percutaneously place screws. This sounds great, and I think that most patients can have a minimally invasive surgery for their bunion. However, there are some personal or patient-to-patient things to consider in which not everyone is a candidate for a minimally invasive option. That is something that would need to be discussed with your surgeon. So over time, procedures have been analyzed for bunions, and they can recur, especially with these procedures that I've just mentioned. They can recur. When it'll recur or if it'll recur is the question. If it'll recur, not sure. The jury's still out. And if it is going to recur, there is a 70% chance that it will return. That's something that I always tell my patients. And when it'll recur can be 5 years, 10 years, 20 years. It's really hard to tell, but I always make sure that my patients understand that there is a chance that after doing these procedures that it can recur. Sometimes it's not as severe, or if it recurs, it's very minimal and it doesn't really give you much problems, but it's something that you need to be informed about. So now we're moving on to sort of a large or severe bunion. And what I'd like you to do is sort of imagine this first metatarsal as the Leaning Tower of Pisa. So you can see in this diagram here, sort of this diagram here on the right, the left or the first image there shows the Leaning Tower of Pisa adjacent to the first metatarsal. You can see how they're both leaning. And with the procedure that I just mentioned to you before, where we make a cut in the bone and shift it over, we're essentially making a cut in the Leaning Tower of Pisa and pushing the top over. That doesn't necessarily fix the problem. That is just, making it look a little straighter, which can do the job, but it's not fixing the problem of why the Leaning Tower of Pisa occurred. So going over to the right image, you can see that to fix it, we have to fix it from the root, or from the base of the building, which in the first metatarsal is at the first metatarsal cuneiform joint. So this lapidus bunionectomy is a fusion of that joint to help straighten it out and also help with the rotation of it. This is a more reliable procedure in that we can confidently say that if successful, leads to a way less recurrence of a bunion. So for those patients that have larger severe bunions, this may be the more obvious decision. But even if you have a mild or a moderate bunion and you're younger, you may want to consider a lapidus bunionectomy because you want longevity. You want to make sure that it doesn't recur. However, with that comes a longer recovery, as it is a fusion. So I would have my patients off their feet for at least 6 weeks until the bones heal, which can be a while. With the other procedures, with the traditional or the MIS, patients are off their feet for sometimes 3 days after procedure up to 2 weeks, and then they're walking with a boot. So definitely a difference in the recovery of these two procedures. So which is right for you? Again, we need to consider a lot of factors when it comes to surgery, your overall health, your age, your activity level, the amount of deformity, whether it's mild, moderate, or severe. And based on those things, we would consider which procedure is right for you. Another thing to consider is that there's a procedure to fuse the big toe joint as we would with big toe arthritis. And sometimes this may be the option of activity that you have and your age. And if you need to be able to walk right away, this may be a procedure, sorry, not this lapidus bunionectomy, but the big toe joint. So I thank you for your attention, and I look forward to seeing you and answering your questions.